The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone, and thank you for joining us. This is Amanda Fox with All Chicago, one more time here, and David Melnick as well, who's already introduced himself. We are here to talk about the HMIS data quality and the assessment process that we're in the middle of right now. So if we take a look at our agenda, you can also pull down these slides from the handout section of the GoToWebinar menu that should be on the right side of your screen. So feel free to pull down the webinar slides, type in a question if you have it. If there's any technical issues, also let us know through the question function. We are prepared to talk to you about generally a review of HMIS data quality. We want to make sure we go through thoroughly the quarterly data quality assessment process. And then, of course, we need to show you some examples on how to correct some common data quality issues. And to start off with a review, there is a data quality plan that we wanted to make sure everyone was aware of. This is available on our help desk, and there will be a link to it at the end of the presentation slides. There is a data quality steering committee. We refer to it, and you'll see it referred to moving forward in the slides as DQSC, or Data Quality Steering Committee. That is a subcommittee of the HMIS committee. And that committee is of a body of your peers. So there it is comprised of HMIS users or representatives from various project types and agencies that use HMIS. They meet 4 times a year at the conclusion of the quarterly data quality assessment process. And that is the committee that is responsible for implementing and maintaining our data quality plan. Part of that plan outlines the data quality assessment, which also occurs those 4 times a year, and those are the months that it occurs within, and the results of the assessment are reviewed by that committee, and they inform any follow-up or things that they want to adjust, and they approve those things for the actual assessment. This is just a bit of information that was pulled from the data quality plan directly to give you a definition of what that plan is and what it is meant to provide for us as a community. So a couple of things to highlight here, that it is in this first sentence at the top, the whole intention of this plan, which the data quality assessment is outlined within it. The intention is to achieve statistically valid and reliable data for our COC. So if you look at the very bottom bullet, as well, this piece around establishing a time frame for implementing the plan to monitor the quality of data on a regular basis, that is the quarterly data quality assessment process. So that plan is available on our help desk, like I said, and there will be a link to it at the end of this presentation that you can refer to later. The quarterly data quality assessment process is led by that data quality steering committee. We administer it through the HMIS team at All Chicago, and it is a review of your project's missing data or data issues, which is new to us, child-only entries, bed and room utilization or bed and unit utilization, timeliness of data entry, and participation is required for all projects that use HMIS. So moving into some of the components of the assessment, we again are looking at that missing data and data issues with a threshold of no more than 5% for each one of those data elements. Then, of course, child-only entries. This is something where it would be an error to have child-only entries reported in the assessment, and that is defined as dependents, people that are under 18 years of age and that are in programs by themselves when they should not be. Child-only entries will also occur if there's a missing date of birth and it is unknown whether the client is over or under 18 years of age. And then utilization. So based on how many beds or rooms the project is contracted to provide, that is something that we measure based on the number of people that are actually enrolled in the project and assumed to be occupying those beds or units, rooms. It's a bit of a tricky one for us to talk through, but we're going to have a few more slides to try to help us break down and help you understand what we mean by bed, unit, or room utilization. And timeliness is hopefully something that's starting to make sense to folks, but we also have a few other ways that we're trying to explain that in a few future slides. But the idea behind that is that we're measuring how many days it took the project to put information into the system. So to review the process and we're going to walk through these steps for you in a demo, you run the report. ATAs are typically the people that do this out of part of our system called ART. They're typically the people at the agencies using HMIS that have access to ART. Not everybody does. But anyone can interpret results from that report if the person running it provides them the report itself. So the report is pulled down from the system, which we'll demo for you, and then it can be emailed or put on a shared drive for other users to access. And at that point, anyone can address and interpret the data quality issues identified in that report, and then go forward to make corrections. And typically, most users of the system can correct their own errors and actually update things that are incorrect or were missing. But then there are cases where ATAs or even the HMIS team will need to assist, and that's a service that we provide throughout the data quality assessment process and an ongoing support through the help desk. And we will go through a demo of uploading into SendSpace as well, which is how reports are submitted. So just to review again, the timeline that you all hopefully already have available to you. The two dates that you want to pull out of these timelines that are released with every single data quality assessment process are the ones that have deadlines, for sure, to be aware of which one of these dates have deadlines associated with them. In red boxes, you see that October 17th was the first deadline for submissions of reports, and there's actually a second deadline as well in the event that a project needed to make corrections. There is up until October 31st is the final deadline, and reports must be submitted by 5 p.m. on that second deadline to be accepted as having participated in this data quality assessment process. Unit list updates are something else to highlight here that a few days before or a week before the final deadline, we ask that any updates to unit lists be submitted to us by 5 p.m. so we can get all that figured out in the system on our end before you have to rerun your reports and submit them for the final deadline. I think we do have a question that popped up, so I'm going to take a quick look. And we will address things around missing social security number, which is definitely a question that several people had. I'm going to hold on to that one for the moment, but we will talk about missing social security numbers as we move forward here. So all the results of the data quality assessment process are publicly displayed on a Google Sheet online. And there's a link always within the emails that we send only to ATAs, and a few of the emails go to executive directors as well, letting them know about this timeline. So this is something hopefully you've seen, but if you have questions about it, let us know. So moving forward as well, you'll see that we kind of are focusing on bed and unit utilization. We also talk about room unit utilization, so you might have interchanging terms here, but they all kind of mean similar things. But we basically want to make sure that projects are enrolling clients, that they are actually serving and exiting clients appropriately when they leave service. And to do that, we measure how many people are enrolled into the number of beds or units the project is contracted to serve. So we use the same method across all projects that actually house clients or provide housing to clients, but you have to keep in mind that this is something that's been set up in our system for both emergency shelters that have a fixed number of beds, as well as transitional housing programs, permanent housing programs that might be doing scattered site housing or voucher-based housing. So this is one system for all project types, and only those project types that provide housing are measured on this. So if there's an update to your contractual number of clients that you'll serve, or households, if there are fluctuating numbers of clients per household, that's what we talk about with unit, then we have a list for you to update to request us to do that for you. You just have to submit a unit list update request. And there's a link to that. It always sits on our help desk, and it's something that's available in the emails that David sends out for the data quality assessment as well. So we just wanted to give it to you here too. And David, of course, if there's anything you want to add in at any point, feel free. Otherwise, I'm going to keep going here.
I'm doing great so far.
Thanks, David. So non-compliance with unit lists. This is not something where we're trying to penalize projects when in fact they might have a low number of clients actually utilizing their beds, or if they are over capacity for any given reason. So keep in mind the goal is accuracy. If it is a reality that your project is under the thresholds that we are looking for or measuring against for your capacity or your utilization, then all you have to do is fill out a form, also available on our help desk, and there's a link here. Let us know why you are not in compliance and that it is in fact something that is realistic. So there is a question I think that is something we should cover now. The question is about a unit list that was empty at the time of So a unit list that was empty. And I'm just looking here real quick at the rest of the question.
So I think I understand this. This isn't going to affect
Yeah.
your data quality. And just to be clear, when for other people, somebody asking about whether a unit list being empty is going to affect the data quality submission. And this is a unit list that has been created in HMIS, but has been emptied in preparation for the pre-PIT. So it's been emptied of clients, but it still exists. And what we're looking at in the data quality assessment is actually the unit list. We're not looking at any of the clients in it. We're just looking at it to see how many clients your project is contracted to serve. And we're using that number to determine how many clients should be in the program and whether there are far too many or far too few clients, such that it would be a data quality issue. Like where it's clear that there are some clients who haven't been included in HMIS, or there are clients who haven't been exited from programs. So changing the clients in your unit list is not going to affect data quality.
Perfect. And that I completely agree. So Rachel is the person asking this question, and you should not fear. If you are preparing for the preliminary point in time count, please continue. That is not going to affect data quality. And we can look at the unit list when we go into the system just to show you that it is just the number of beds and units that we're looking at and not who's in them. So moving forward from this, we did want to give you something else to consider with timeliness, if that's been something that hasn't been clear yet. And it truly is the easiest way we can think of to say this is a measure of the number of days it takes for data to be put into HMIS. So we have a small little equation here for you to show you that we are looking at the date that an entry is created in Service Point. So it's the data's creation date, and that compared to the date that the client was actually enrolled in the program. So subtracting those from one another gives us how many days it took you to actually put that data into our system. And the expectation is that that would be no more than 2 days. Otherwise, timeliness would be considered out of compliance for that particular piece of data. So keep that in mind. This is something that is measured before we actually do the data quality assessment process. We're measuring the timeliness of the data that is entered right now for the January data quality assessment process. So you cannot correct this. Timeliness is something you cannot correct. It is only a reporting thing for you to see how you did with your timeliness throughout the quarter leading up to the assessment. So I think I had another thought, but it's gone. So we might move forward on that note. Unless there are questions, feel free to type them in if there are any. And now why? Why are we measuring data quality, and why do we want good quality data about our clients from HMIS? These are the main 3 reasons David and I could think of that we thought would help you all in having these conversations internally, and perhaps yourself understanding why this is important for you. We are a system, so we are all in this together, and that means that our data is only as good as its collective measures, if you will, around data quality. It is no one project that sinks that ship. We literally are all in this together. So all of your data is rolled up into these large system level reports. AHAR is the one thing that goes to Congress from our system and from every system across the country. And we strive to have the best data quality we can to ensure that our data is included in those the data that is aggregated across the whole country in order for Congress to make legislative decisions about the community we serve. So AHAR is the Annual Homeless Assessment Report. Our team is preparing that submission now using your data. And the data quality assessment process is driven around the AHAR year, which begins in October every year. So that's why our quarterly data quality assessment process shifts the way it does throughout the year. And we very much appreciate all the data that you enter to inform that report. Data dashboards are another thing that our system is starting to create based on the data that all of your projects are putting into the system. And it is used by local city and even local agency level decision makers or leaders in helping drive how programs shift or funding changes and things like that. So data dashboards are extremely important, and accuracy is the only way to make sure that they are the most useful information we can provide. Coordinated entry is, in practical terms, another reason that you want to make sure your data is accurate and timely in terms of its entry into the system. And that ensures that our clients are actually getting the best services possible, so that we are referring clients only when they are actually in need of housing, and we're never neglecting clients that need to be put into that queue. And those are things you can take back with you to talk to your staff or leadership further about why this is so important and why your time is well served in supporting our collective goals of good data quality. I think we're ready at this point to move into some examples, and I'm going to leave this PowerPoint presentation and come over to our advanced reporting tool. I'm in Service Point now. I've connected to ART, which is something that mainly our agency technical administrators have this button in their upper right corner so they can connect to this advanced reporting tool. And what I've done is expanded some folders so I can contract them again to show you that this is running the report. If I expand the public folder and I come on down to my Chicago COC reports folder, and I'm just going to increase the size of my screen here for you. And then as I keep navigating down to the data quality folder, I would then come to Chicago's data quality file or report. To initiate this, I'm clicking on the magnifying glass and I'm viewing this report to run it right now. It's taking a few seconds to process, and what it's going to pull up for me is a window with prompts. And David, you're going to have to tell me which provider I should run this on.
Sure. It's going to be the All Chicago PSH one.
Okay, cool. So we'll search for that provider as soon as it's done refreshing data here. This is a part of the system that does require some patience. And what we've done is prepared so that we can do this as quickly as possible. And as soon as I'm able to walk you through how you set these prompts, we're going to switch to David's screen where he has the report ready to go so that you can learn how to download it quickly without waiting too much here. So there's going to be just a couple prompts we're going to fill in. Keep in mind that David pre-populates the prompts to set them up so that they're prepared for the time frame we're looking at. We always look at 1 year's time frame. We're going to only need to put in the provider that we want to run this report on. So that's the only thing I'm going to show you how to set up before we hand it over to David. And sometimes it takes a while to run. Well, perhaps we should move to that next step now. Not yet. Oh, David is still processing too. Huh. Believe it or not, we prepared for this to try to avoid making you wait for ART to run. But without fail, ART always has a mind of its own. Do we happen to have the report already up in an Excel file, David?
No, mine should be done in a little bit. One thing to note with ART is that if you run it or if you open ART like Amanda's doing right now, and you decide, you know what, I know this is going to take a really long time, I'm going to go to lunch. When you come back, sometimes it is timed out and you can't access it. So that's another frustrating thing about ART that, I mean, you just have to think ahead and avoid. So if you are opening it up, you know, you're going to have to be at your desk, or if you're getting up, you know, have it only be for a few minutes, because you definitely don't want to wait for something to load and then wait too long and have it time out. And that can happen at any stage. So once Amanda gets prompts here, you know, she'll enter the prompts and then she'll have to wait again as the report runs. And with that as well, you know, like that'll take 5 minutes or whatever. And if you leave that page for too long, that gets time out as well, and you won't be able to download the report. So a number of things to think about when you're running ART reports, and just be careful with them, because if you're not careful, it can be more frustrating than it needs to be. There's always going to be a certain level, but we try to minimize that as much as possible.
give you the controls. Your report's ready to go. Mine's going to time out here eventually. So I'm just going to change the presenter to David's screen so we can see what it looks like. You ready, David?
I believe so.
Here it comes. Okay. So let's see how we did. There we go. I see your screen now.
All right, so this is the All Chicago PSH project. This is where we put some test data or some data that we want to show you guys without actually affecting any client records. So I've run the report. You can see there are tabs down at the bottom, and I'm going to go ahead and download this onto my computer. When you download it, so you're going to go over here to this document button, and there are two options here. There's save to my computer as and save report to my computer as. You want to use save to my computer as. If you use save report to my computer as, it's going to only select one sheet from this, only one page from this, whichever page you're currently on. Save to my computer is going to get all of them at once. So I'm going to do Excel 2007 and open it. And actually, right after I open it, I'm going to go ahead and save this using using the conventions that are in the data quality instructions. So I'm going to save this as, so a lot of times it's going to show up with this copy of, so go ahead and get rid of that. These 4 dashes right here are for the program number, or the project number, excuse me. And in this case, it's 1415. And then these dates right here, so this, this year and then month and the day, this corresponds to the day that you run the report. So today is 2017, month is 10, and the day is 26. And you see you got this little -4. That's because it's the fourth, when you download multiple files with the same name, it's got to change the name. So I'm going to save it as this so that when I eventually submit, it's already in the right format. Okay, and we're going to go move over. So this front page shows the aggregate data. This is helpful to know. This is helpful for us to know at All Chicago, and for you guys to know about how data is looking across the board. But if you're actually doing work on this, you're going to want to go over to these later tabs. And we're going to start with this assessment detail tab. And this assessment detail tab shows for each client which pieces of data might have errors. As you can see, we've got a number of clients with errors here. Another thing to note here is that this is kind of a tricky spreadsheet. In order to keep this on one page, we had to sort of double up the rows. So this client right here has 2 rows worth of data, and the top row corresponds to these data elements, and the bottom row corresponds to these data elements. So just be careful when you're looking at this. They're separated by this, this thicker bold line right here, but just know that there are 2 rows here, and you got to make sure you know which one we're looking at. So there's a lot of missing data on this, but we are only going to focus on this stuff here at the bottom, these 2 clients right here. So the first thing here is that there's a data issue with social security number, and this is actually kind of a common problem that we've been hearing a lot about. So I'm going to go ahead and grab this client ID, head back over to Service Point, and log in because I got logged out. If you got any fans of the Fast and Furious franchise out there, this one's for you. So there's a social security number data issue, and if you're looking at this, it's kind of obvious what the social security number data issue is. It's not a valid social security number. It doesn't have enough digits in it. So we're going to go over to the client profile and edit this. So the social security number, we need the first 3 digits, and let's go with 919. And then we save it. And something important to note is that this will not automatically show up on the data quality report. You have to rerun it, and you also have to wait a full day in order to do that, because the data in Service Point over here gets loaded into a warehouse, and then the warehouse is what supports ART, is what supports the advanced reporting tool. And that load only happens once a day, and it happens at 2 o'clock in the morning. So you have to wait a day in order to see any changes in the actual report. So this social security number now is correct, but it won't show up in the report until the following day.
Can I take 1 second, David, to, while we're here, just respond to the question and a few of the people's questions that are here to understand why we're looking at client doesn't know and client refused answers for the social security number data quality question and including those as missing data in your 5% thresholds. You'll see that they were data issues in the report, but they are included in the 5% threshold. And October is the first month where the values under social security number data quality of client doesn't know or client refused to answer the question are included in the 5%. So the reason behind that is there has been a shift on a federal level where HUD is including those two values in that measure, in their measure of missing data as well, in reports that a lot of the projects in our system are required to submit. So to follow suit, we tend to follow along with HUD's guidelines around data quality. And to make sure that we were up to speed with that, we, starting this quarter, have started including those values as missing as well. So the reason behind why those are considered missing information is that as a system, and HUD encourages this, it is necessary to have client social security numbers for a variety of things that we do to provide services to the clients in our system. So the idea is that you want to make sure you can try to obtain this for every client as possible to obtain the information for. And then if you are serving clients that do not have social security numbers or truly just do not know the answer to the question and can't provide it or refuse to give the information to you, you will have to use those values of client doesn't know and client refused. The goal is to make sure that those are as few as possible by starting to commit to asking clients for this information consistently and routinely. But that doesn't necessarily help you in terms of the questions people have been asking us with how to get rid of the high missing data rates. It is not possible to get rid of the high missing data rates if the answer remains client doesn't know or client refused. Those are still the correct answers if those are the responses the client gave to you. This is meant to be based off client self-report. Their social security numbers are shared in the system. So if the client didn't give it to you, but it's in the client's record, that's one way that you won't get dinged for this being missing. But if truly the client has refused to give it to anyone in the system or doesn't have it or doesn't know it, that is something that every project that serves that client will see included in their rate of missing data. So let me know if you have further questions about it, but that's what I'll say for now for in the essence of time to make sure that we show all the examples we need to. And there's a couple more questions that came in. And a client that would be considered an illegal immigrant that does not have a social security number, the correct response for the social security number data quality question is client doesn't know. That is what the HMIS data standards, the manual that we follow, that is the guideline that we encourage you to follow as well. And the expectation of us as a system is that if clients do not have social security numbers, they are listed as client doesn't know. And that is where I'll end it on that. And there's a question from Jose about whether we're submitting the data quality reports with both PDFs and Excel files. And I'll let David go back to where he was.
Yes, you do have to submit the PDF and the Excel. So downloading the PDF file is very similar to downloading the Excel file. You go over here to Document, Save to My Computer, and instead of selecting Excel, you select PDF. And then again, you can open the file and then save it using the that same naming convention. So this would be, I'm not going to save it because I don't want to clutter things up a little bit. As far as just a little bit more about Social Security number, this was a decision that was approved by the HMIS committee and the Data Quality Steering Committee for us to be looking at this with the idea that we don't want anyone to be surprised by their APR. And we, as All Chicago, when we submit our APR, there is kind of a lingering possibility that we are also going to be looked upon unfavorably if we've got high rates of missing data or data issues for any of these elements. So the decision was made that that this would count, that these data issues would count against projects for the data quality assessment. And if that's something that you guys as ATAs, have strong feelings about, then we encourage you to come to the HMIS committee or the data quality steering committee, and voice those and make sure that people understand that. All right, so let's head back over to the report and look at some other things. So with this same client, there's also a data issue for date of birth. So let's go ahead and check out what that might be. So I'm still in the client, and let's head back over to this particular entry. And you can see the date of birth is inputted here, but the date of birth type is listed as approximate or partial date of birth. And HUD has given us the recommendation that this needs to be full date of birth reported. So you got to try as hard as you can to get the complete date of birth from a client. And if this in fact is their full date of birth, and this is the exact full date of birth, then this was just an error in selecting the wrong value there. So this should have been clicked as full date of birth reported. And I'm going to go ahead and save and exit. And now, oh, I'm sorry, Excel. Now we've got a few other things here. So we've got some issues with HUD verification and with mismatches. So there's a HUD verification in this, and you got to trace it back up to the top. This is with income at entry. So I'm going to head back over to Service Point and reopen this entry. And this was income at entry. So you can see with the income at entry section, there is this red triangle here that says HUD verification. Go ahead and click, what you're going to do if you see that is click on the HUD verification, and you can see down here at the bottom that that we haven't specified anything for the other category. So the idea of HUD verification is that when you interview a client or when you assess a client, you're asking them every single question, because they may have some income that they don't think about as income, and they wouldn't think about it as income unless you had asked the question. So what you need to do here is indicate that you asked the question. So let's just say that we did ask the question, and they said that they were not receiving any other source of income, and you could check this no box right here. If you're doing this quickly, the client only has one source of income, and you asked all the questions, you can say, you can enter that line of income, and then you can mark up here, no. And what that'll do is it'll autocomplete all of the rest of the values to say no. So you don't have to input every single one of these sources of income. So we're going to go ahead and do that. You can see it automatically populates right there as no. And then I'm going to save and exit. And the cool thing about this HUD verification is that unlike the rest of the stuff in the report, it does give you sort of like automatic confirmation that what you did was correct, because now this HUD verification shows up as a green check mark instead of that scary red triangle. So let's head back over to the report. We've got a mismatch for disability entry. So a mismatch is where there are two questions in the assessment that have been answered in contradictory ways. So mismatch for disability entry, so we're gonna head back over here and find the disability section. All right, so the two questions in this case are this question right here: does the client have a disabling condition? And then if we open up this disabilities thing, we see that none of these disabilities are. We haven't indicated that any of these disabilities, are true for this client. So what we need to do is because we're saying this client has a disabling condition, then one of these things needs to be indicated as the disabling condition that the client has. So we're going to say this person has a physical disability. So we edit this one and we say yes, and yes here, and Yes. So now we're saying that this client does have a disability. We're going to save this, and this is no longer going to show up as a mismatch. So next out of that, and then one more, there's a HUD verification for insurance at entry. And this is just a practice. You know, you guys have seen this, but we can just take a look at it. Look at this. We haven't done anything. We haven't completed anything. So this client is not covered by health insurance, and you've asked all the questions. If you want to do this quickly, then you can go right here and say, no, they are not covered. Save and exit. And look at that. We've got a green check mark there. Okay, so now we're going to look at this client. So you can see right off the bat, there's a data issue for Social Security number. So let's grab this client ID and check it out. We're gonna head over to the client profile. So you can see with his Social Security number, there are, we have all the digits of a Social Security number, and the Social Security number data quality is listed as full Social Security number reported. However, HUD, because they are the government, knows that this is not a Social Security number that that they hand out. All fours or all of any of the same digits, those are not Social Security numbers that that the government issues. So it knows that this is incorrect and references it as a data issue. So what you have to do is go back, look at the client record, or speak to the client again, or speak to the client's family in this case, because the client's only 4, and get their real Social Security number. So let's go ahead and change this. And let's say that that was correct. So that'll fix that issue. We've also got a situation over here for HUD verification for insurance at entry. So a lot of these sub-assessment questions aren't required for people who are under 18, but insurance is one that is required for all clients. So we'll head back over there to the summary and then into the entry. And you can see, like Dominic, nothing is selected here. So we're going to say this person is not, and do this quickly. All right, so that takes care of both of these issues in the assessment detail tab. Now we're going to take a look at child-only entries. You can see in this in the summary tab, there is one child-only entry. And if you want to see which child that is, you can look for tab C. And that is 424820, which is actually the client that I'm looking at right now. And this is Brian Toretto, who is, for those who are familiar, is Dominic's son, named after Brian O'Connor, excuse me. This client was entered without the rest of his family. So Dominic and Brian were entered into this project separately, which is a problem because chances are they came into that project together. So we're going to go over to Dominic's record, and since they're connected in the same household, we can just go ahead and click right here to transfer to the other family member, which is something that is very handy in fixing this.
Hey, David, do me a favor and go to the Entry Exit tab and show them how they'll know that these clients were entered separately from the client count.
Sure. So I'm back over in Brian's, and I can look at the Entry Exit tab, and we can see the client count is just, there's this magnifying glass and there's the number 1, and that's saying that this client is entered by themselves. There are a number of other ways to see that this client is entered by themselves, but this is probably the easiest. And if we head over to Dominic's again, we can see that he is also entered by himself. And that is a mistake. So we're going to go over and enter, or excuse me, and edit this and pause here and include an additional household member, and that is going to be Brian Toretto. And it is possible to change the date of entry for individual clients. And this is applicable if you've got a family staying in a project for a long time. And then there's a child who is born. When you enter that child, you include the additional household member, but then you have to go over to that household member's entry, and then change the entry date for that client, because they can't. It's going to show up as a data issue if their date of birth is after client entry, because it doesn't make any sense for a client to enter a project before they're even born. Which is not something we're going to do right here, right now, because these two clients came in together at the same time. So I'm going to save and continue, and then scroll down on the bottom once this finishes loading. Save and exit here, and now you can see the client count is up to 2. One thing we have to think about, though, is that old entry for Brian Toretto still exists. So I have to head back over there and delete that. Because now you can see that there are 2 entries here. Because we have submitted some information into Brian's entry, you should save or take a look at maybe screen capture the information that's in the assessment that you created, just to make sure that none of that information gets permanently deleted. And then once you've done that, you can go over and delete that entry. So you don't put in an exit date or anything like that. You go to this trash can. You can see it's the one with only one client, the one where he's entered by himself. We go to the trash can, and we delete this entry exit, and that'll fix that child-only entry. I believe there were a few other examples that Amanda wanted to go over quickly, but we are pretty much out of time.
I wanted to actually let people ask any questions they had. We are happy to stick around for a few minutes beyond 4:45 or 11:45, but we don't want to go into other things that you don't need to see today. We'd like to hear if you all have questions to tailor anything that we might need to show you to get you the information you came here to get. If you did get everything you needed today and you are satisfied with what we've provided, great. You're welcome to leave the webinar. If there's something else that you want us to cover that you haven't yet seen, let us know right now and we can do so. We really appreciate all of you being here today. Remember, the slides are available for you to pull down if there was helpful information there for you. There is a lot of nuances to data quality, and I'll just talk about some of the other things that I was considering showing. If you want me to, I can do so. I was going to show 2 other scenarios with child-only entries that can occur. One of them is when a household exits your project and you forget to exit one of the children and they remain enrolled. That is another scenario where that can create a child-only entry. The way to fix that is just to exit the child's. And separately from that, the last example of how a child-only entry occurs is if date of birth is missing and has not been entered into the system through the entry assessment. That's another scenario where the report can't see whether this is someone over or under 18, and the information is triggering a child-only entry. The only other thing that I was considering showing you all is Shelter Point and the unit list that we use to calculate your utilization of your beds and units. So if anyone wants to see that, let us know. But otherwise, you are welcome to leave, as I mentioned. Debbie, you're welcome. Thank you for joining us today. And for Levon, you just asked a question about when a client refuses to provide their Social Security number. You don't need a Social Security card. That's not a requirement to collect the information for HMIS. It's only asking the client for their Social Security number. If they provide that number, great. You enter it in the system and assume that that's correct. If you are not provided that information and the client refuses to give it to you, then you would indicate client refused. Richard, you can pull down the PowerPoint slides from the handout section of the menu itself. You should have a PDF under handouts that is the slides that we went through, and you're welcome to pull that down. If that isn't visible to you, we can certainly email them to you afterwards if you need, but you should have access to them right there. And great, I'm glad you found those, Richard. So, and Levon, I wonder if you were actually asking about a client that refuses to go and obtain their Social Security card while they're in service. and you would indicate that the client refused. Not that you can't keep working with them. If you're in a program that serves clients over a period of time, you can continue working with them to obtain their Social Security card, because one of the system level intentions behind having access to client Social Security numbers and highlighting that as information that's important to have on file is to support that client in connecting to mainstream resources. So the intention of our services is to move clients into stable housing and out of homeless situations. So with that, Social Security number is viewed as an important piece of information to connect them to resources. So that's certainly something that you can work with clients on, and at some point while they're still enrolled in your programming, if they obtain it and provide it to you, you can always go back and enter it, and that missing data will go away. So that's a good question, actually, to talk through how you can work with clients around this piece of information. So at that point, I don't see any more questions coming through. We, again, really appreciate all of you being here and the time that you've given us. Good luck with your final submissions of your data quality reports. We are doing our best on our end to keep up with everything and give you back timely responses to the questions you've submitted to the help desk. And you are welcome to reach out to us. So I'll go ahead and end the webinar, and we'll talk to you all on the help desk. Have a great rest of your day.
Thanks, everyone.